Crystal Graham with Augusta Free Press. I'm joined today by Kimberly McClanahan with Valley Community Services Board. She is the executive director. Kimberly, thanks for joining me.
Thank you for having me.
So I thought maybe we'd get an update. We talked some time back about some plans that Valley Community Services Board has for a regional facility to address mental health. I know there were plans to start groundbreaking in 2025, but you are hoping to secure a location. Have you been able to do that yet?
We are close. Uh, we do not have the final papers in hand yet, but we hope to have a location secured by the end of the calendar year.
Yeah, so that's very close, I guess you could say.
Very.
Um, so what's the timeline for that? So if you secure the location by the end of the year, how do you see things shaping up?
Well, we would hope that we would immediately then begin to do the architectural engine. We've done some engineering, obviously preliminaries on the property at this point, but architectural work, and I believe our director of finance here at Valley has put us at if all this goes as we hope, groundbreaking by fall of 25.
Wow. Yeah. And so even if you break ground in 2025, I know that you've talked before about how staffing, finding people to fill these positions can be challenging. How do you see all that working?
Well, I think that we will begin. Right now, we're working on securing a project manager to sort of oversee the entire project. Experts as we are not, and then we're expecting that the actual building capital project is going to probably doors won't open till 27
Okay.
at some point. So in between groundbreaking and then we certainly would be attempting to begin that process of getting folks in place early, with like certainly 6 months or more before the doors open for those positions that'll be doing writing policies and sort of running the place and doing any contracting or that we might be doing, for example, with Augusta Health around some of the things that they might be able to help us with. So we would be working on that actually like from now until then. But again, it will be unless something happens that's a miracle. It will be a challenge to get all those positions filled by the time we're open. And the fact of the matter is, we're not going to fill 16 chairs and 16 beds the day we open either. So there will be a progression that we'll be able to build upon.
Fundraising has been a not a challenge, I'll say, but it's always challenging when you're working with the state and hoping to get some funds from there as well. I know that things have kind of been in flux, but we know that the current governor does have a focus on mental health and he has identified this project for funding. Where do you guys kind of stand now with the money that you need to move forward?
Well, we have a written notification that we will get $9.6 million from the Department of Behavioral Health. So that's a good chunk. We also already have some funds that our board of directors have put by and some other additional funds that DBHDS, Department of Behavioral Health, have given us, and we have some other grant funds. So we probably have additional 4 to 5 million there. Uh, we are going to be speaking, we being myself and some of my executive team are going to be speaking with the city managers and county administrator of Staunton, Augusta County, and Waynesboro this next week about opioid abatement funds,
Mhm.
which are eligible to be used on this kind of a capital project because it will have a detox component. So we're very hopeful that there will be some funding that will come from that as well. Um, The other thing that Valley's working on but has not happened yet is that we're in process of getting our own 501c3, and it's been with the IRS now for a long time. So we're not sure when that will actually be up and going, but we've been in process with that. And depending on when and how much we need, I mean, that might be another option for donations down the road.
What do you guys estimate the project cost at? I know you've still got some work to do there, but I'm sure you have a rough idea.
Yeah, think I wish I had pulled up this Excel spreadsheet in front of me. I think we're looking at around 15 to 17 million
Okay. So you're
on the
not too far
capital.
off.
Not too
Yeah.
bad.
No, you're not too bad. So, I guess one thing to kind of just take a step back for if folks haven't read the stories that I've written and other media has, can you tell us a little bit more about the project and just I know there's two components to it. Can you tell us a little bit more about what it's going to look like and how it will address mental health needs in the valley?
Yeah, absolutely. Uh, our hope is that it will be around 25,000 square feet. It will house two components. Well, actually, it will house more than that, but let's talk about the main components.
Okay.
So the two components that we're really focused on are a 16, it's a 23-hour observation area. There'll be 16 what we would call chairs or recliners. So it's not beds, but it's a place where somebody in crisis can come in or be brought in, be evaluated, and they can be there according to the law and regulations for up 23 hours and 59 minutes.
Okay.
And at the end of that time, a decision must be made. Are they able to be de-escalated and go back into the community, to their home? Do they need to be stepped up to a crisis stave unit, or do they need to go to the hospital? So you have some options there with that 23-hour observation. The other piece of it that will be obviously very important is that 16 beds or 16 CSU, crisis stabilization unit beds, which will be flex beds for detox and mental health. And those are a little bit longer term. Probably a general stay is going to be 4 to 5 days, but depending on the situation, can be up to 15 days where somebody could stay there. Again, uh, can be stepped down, and from there, generally, they're going to be obviously stepped down back to the community or stepped up to the hospitalization should that need arise. So those are the two main components. What we want to see happen as well is to be able to bring the majority of our crisis services into that building. So
Okay.
where we would have our emergency services, where we would have our mobile crisis come out of, where we would have a Marcus alert when that comes to fruition in 2026. And that's the Marcus Peterson legislation that came up several years ago that Augusta County at least will have to fully implement according to the law in 2026. Valley will be a very integral part of that. And a lot of those models are a co-response model where you bring it's law enforcement and clinicians together. So we would like to see that actually come out of that building as well. So we'd like to see all of our crisis services there. But the main things are the receiving center and the crisis stab unit.
Well, I do want to talk about the mobile crisis and also what you all are doing now, but just for a second, if we could maybe just go over kind of what the mental health picture is right now. Like, what are we as far as like if someone is having a crisis right now and they end up at the hospital, like what is happening now and how will this unit kind of help solve some of the issues that we're having?
Sure. Well, one of the things that we have done here is that, we've heard loud and clear from law enforcement, we need help now. We
Mhm.
don't, I mean, we need help in 2 years, but we also need it now. We need to decompress the emergency department. We need to be able to get back on the road and do our main day jobs.
Mhm.
And so one of the things we've done here at Valley is to actually set up a section of our emergency services department where we can accept ECOs and TDOs right here, up to three. And that is functioning. And so we're hoping already to be starting, now it hasn't become full-fledged yet because we're still learning it, but it is open. And we're hoping to decompress the emergency department to some degree there. We also have law enforcement on site. So when somebody drops somebody off, if a law enforcement officer drops somebody off, they can drop them off. They don't have to wait with them because we have somebody right here who can be observing them as we're doing the evaluation. What we hope for with the full unit is that we will much more decompress the emergency department because we will have much more capacity to do exactly what I'm talking about here with our little three recliners, because we'll have the capacity and we'll have security and law enforcement there so that when somebody drops somebody off, law enforcement officer can go back out, do their quote unquote day job.
Mhm. Yeah, and so for people who don't know, when somebody's in crisis, until they're placed somewhere, if it's determined that that's needed, that detention, then an officer kind of has to sit with them at the hospital or whatever. So,
That is the law.
um, yeah, and so it can spill over to considerable time for law enforcement. Last time we chatted, you said that that the local governments and all that kind of thing, it was kind of like paperwork that was holding up that side as far as the three units that you have there. Are the localities now 100% on board with that?
Yes, the MOU for jurisdictional uh, capacity is signed, so we are able to accept folks from Staunton and Augusta County or Waynesboro. So that all it took a while, but it
Mhm.
got worked out.
I was chatting with an officer in the Harrisonburg area recently, and I know he said that he would love to see some cross cooperation with even some areas maybe outside of Stanton, Waynesboro, and Augusta County to be able to utilize services. Have you had any of those conversations to date?
I hmm, not with law enforcement, but it is our uh, what our understanding that you know somebody within an hour of here. I mean, they don't
Hmm.
have to be in our state in Waynesboro or Augusta County to come to the crisis receiving center if they are within. I mean, Highland County is 2 hours away, but it's in our catchment area. So we're not going to turn people away. I think that what we would say is that our own are first served, but we're here for everybody. And we know that Harrisonburg only has, 7 beds
Hmm.
in their CSU. So, we're going to be possibly getting people from there, getting people from Rockbridge. I mean, so it's not as if we are, there's a fence. There is
Right.
no fence up.
So with the temporary Valley Community Services Board location and being able to accept 3 people, what has been the response so far? When did you guys get that up and running, and kind of how much traffic have you seen since you started that?
We haven't seen a whole lot yet. But I think that that's going to change as people understand it more. We're still kind of sorting out, what do I say? Who's who's it okay to bring here? If you're looking at very medically fragile folks or folks who need it. So we're still trying to sort who goes to the ED versus who can come here and be safe and do what needs to get done. So it has not been, I'll say that and then we'll have an explosion, right, of people. It has not been overwhelming yet, and we're still staffing it some, but we're excited that uh, it is going to go, and it's getting there, but it's not been, we've not been overrun at this point.
And when we talk about mental health, obviously there's a major problem among teens across the country, children and teens, when it comes to that. How will one, is your temporary facility able to take in younger people, and how will the larger facility be able to serve that at need, community that's at risk?
Yeah, that's a great question. And I don't know that we have a full answer, certainly to the second part of the question, in terms of, I mean, we've certainly talked about having in there the capacity to do some work probably with teens, not so much the younger kids. So we're talking about that, and there's certainly a need. I mean, across the Commonwealth, there is a shortage of children's crisis day units. So we're discussing that, but I can't say that we have a real good answer for you on
Okay.
that one.
Um, And so, right now, a lot of people, if they're going to the emergency room and if they need that longer term care or that plan, before they're released, and oftentimes come to you all for counseling groups and things of that nature for those kinds of services. Um,
Mhm.
but how does your facility, or how well your facility, kind of differ from some things that people are already familiar with, like Crossroads?
Well, it's not a hospital,
Mm-hmm.
number one, and Crossroads is. Uh, so I mean, if somebody needs a hospital for whatever reason, we're not it. Now,
Okay.
we will do medical clearance. And so for people who are medically able to be in a residential facility for short term, then those are the folks that we can accept. Are there some people who are at Crossroads now who might be perfectly acceptable for the crisis stab unit? Probably. Yeah, I don't have the statistics in front of me, but I would say, yeah, there are some people who are in the hospital now, which is part of the reason we're doing this, right? That could be served in a less expensive environment for a shorter period of time and sent back into the world. So I'm guessing that that would also impact that to some degree, but there's always going to be the need for the hospital.
Yeah, absolutely. Before I shift gears to mobile crisis, I thought maybe I'd just ask you, kind of open-ended, are there things that we haven't talked about that are part of this project that you want people to know about?
Um,
That's always a hard question, I know.
Well, and you're pretty thorough. So I think that what I would want people to know is that we are very dedicated to this, as the community or some of the community knows. I mean, this has been on the radar since at least 2018, when Augusta Health did sort of that initial assessment of, yes, we need this. So we're very dedicated to making it happen, and are very excited about what it will do in terms of just broadening that continuum of crisis services here in the area, which are much needed.
Yeah, absolutely. As someone who's volunteered and worked in mental health, it's definitely a need, and rural communities like ours certainly are behind some of the larger cities as far as what's available. And so
Mhm.
that's kind of shifting into the mobile crisis units in larger cities. It's very common for them to have sometimes even more than one mobile crisis unit that responds to somebody who's in crisis. I know Harrisonburg is actually putting some positions in place, like mental health responder type positions to go with officers, kind of like you were talking about earlier. Tell me a little bit about this mobile crisis unit. Is it operational and what it looks like?
It is not operational because we need employees.
Hmm.
So we have vehicles, we have peer support folks, but we do not have mental health professionals at this point to go out and do the work. So we are hoping we're the applications are out there for folks to come do this. So we have a proposal out there. We have money available. And like I said, we have vehicles ready to go to do this, but we are still searching for those employees to get in the vehicles and go do this mobile crisis work, which is, actually done in somebody's home.
Hmm.
And a wonderful, wonderful, thing, but we just don't have the capacity in terms of employees at this point to implement it. But we have the infrastructure. We just
Hmm.
need to put bodies in the vehicles and get them out to the folks.
Well, what do you think is holding people back? Like, what do you think the biggest struggle is with getting people to work in mental health? I've heard, statistics that say that COVID really impacted the mental health community, but do you attribute it to that, or is it something else?
Well, this is just me speaking. I don't think that people are going into behavioral health professions as much, and we're seeing that. And I'm, I mean, my best guess is that, it's not a very lucrative field to
Mhm.
go in.
Mhm.
So unless you have a passion for the work, uh, it's not as appealing as going into computer science or business or whatever, where you're going to make twice as much. So I think until we put our money where, in my opinion, it needs to be,
Mhm.
which is in human services and helping humans, then we're going to continue to have that struggle. And particularly as people older like me are going to be, we're graying out of the
Mhm.
workforce. And as that's happening, we are not being replaced
Mhm.
with the young ones.
Yeah, I mean, I definitely think it's a challenging profession. It's something that you probably
Mhm.
take home with you more than you do computer science, things of those
Well,
things.
yes.
And so it takes a toll. But what are kind of the requirements? Is this for the positions that you're looking to fill specific to the mobile crisis unit? Are these people who have master's degrees? Is it a bachelor's degree? What are you looking for specifically?
Yeah, in order to do some of the work, people do need to have a license. So that's a master's degree. Some of the work can be done by people with bachelor's degrees, but you've got to have the oversight
Mhm.
with the folks with the licenses to be able to do that. Um, so yeah, we're looking at those kinds of positions, and I really think that. Uh, we at Valley, we try to grow our own, so to speak, getting people in who are in master's programs around us, have them do their residencies here, and then hopefully actually uh, retain them as they're going for their license and then keeping them. And that's a lot of community service boards are trying to do that at this point. Kind of grow your own, because they're going to be more likely to stay. They have some loyalty there, in terms of what they've learned, if they've had a good experience as a resident, that kind of thing.
And so, what does the recruitment look like? I mean, if let's say, you do get some people that that apply that are qualified, what does that look like as far as the turnaround time, since you do have the infrastructure in place? And I'm just curious, like, in the medical community, because you're not the only person hiring for very similar positions.
Correct.
How do you like, what do you do? I mean, other than paying more than the competitors, what else are you doing as far as recruiting people to these positions?
Well, you may see our advertisements on WHSV all the time. I think they're pretty good. But like others, I'm sure others are doing this too. I mean, sign-on bonuses.
Mhm.
Valley also has excellent benefits. I mean, we have excellent benefits. I'm not quite sure that our younger generation appreciates that as much as some of us older people do. Uh, and we have a very family oriented environment. So people are able to, when you know, they don't have to be in here at 8 and leave at 5 or whatever. That's the general rule. But if you have family things, I mean, we're humans and we deal with humans. And so we have an environment where we allow our folks the flexibility to do what they need to do when they need to do it. We also have, flex schedules. Some people work at home, and obviously a mobile crisis person is not going to be able to do that. But we try to be as flexible as possible with the jobs that people have. And we really do have, last year we did a market adjustment and upped salaries considerably
Mhm.
for everyone who wasn't at the market level, which still puts us behind the 8 ball in terms of privates. That's always going to be the case until there's just more value placed on what we do.
Yeah. Yeah. So all the things that we're kind of chatting about today, we've talked about briefly before. Is there anything else on the horizon or anything else specific to mental health that you all are working at Valley, maybe that we haven't talked about before?
Not specifically. I mean, within the state, there are always changes with, the Department of Medicaid changing this, that, and the other thing. So we're always anticipating different things, but no big pushes at this point, that beyond, I mean, I will tell you that the receiving center and a stabilization unit are pretty major. So
Yeah, there's a lot on your plate already.
yeah, a lot on the plate, and we are also renovating. I may have mentioned this to you before. We're renovating a house that we have to put an intermediate care facility there, which is for intellectually disabled folks. And it's a 24/7 facility that will house 6 people. And that's been quite a project, just the renovating. So I'm not even sure what to think about when we're building from the ground up. I'm hoping it'll be easier than a renovation.
Yeah, you talk to local governments and some of the projects that they're managing and that kind of thing, and there seem to be a lot of delays, like even engineers and things like that are in demand right
Mhm.
now, and they haven't been
Yes,
able
they
to
are.
fill some of those positions. So, there's a lot of challenges, I'm sure, on the way for you all. But I wish you a lot of luck, and I'm glad to see that a lot of the funding has come together, to make this a reality for folks in the area.
Yeah,
It's definitely
absolutely.
needed. Yeah, so I do appreciate your time very much, and I'll just give you the opportunity for one final comment just about mental health in the valley and just the impact that you guys are having right now.
Well, I like to think that we are having a good impact. In fact, this morning we had the Chamber of Commerce over here at Sanger's Lane to do I think they call it Coffee and Connections. And there were 15 or 20 community members, business folks who were here, and we did a presentation of the things that we do. And just me doing that and looking at the power and thinking, my goodness, we do lots of things for lots of people. And I think for the most part, we do it very well. And we are there for the clients that we serve. And the clients that we serve are everyone, but those who have the fewest resources and the most need are the ones that obviously are the focus of the public mental health system.
Yeah, I think Valley Community Services Board, a lot of people in the community, just don't really know what you guys do and until there's a crisis, and then maybe learn a little bit more about that, whether it's them or a family member, or anything like that. And I know you guys do a lot more than that, but
We do.
yeah, so I want to thank you for your time
You're
today and
welcome.
updating us on the project, and I look forward to sharing this information with our readers as well.
All right. Thank you. I hope you have a great weekend.
Same to you. Thanks, Kimberly.
Bye-bye.